Today we're here with Kara Foster, who's running for Town Council in Holly Springs. And the first thing I'd like to ask you is, why did you choose this location?
I love this location. I love downtown. I'm a small business owner myself. I love being able to come down here, go out to dinner, just check out go to yoga here, and there's just a lot of great amenities downtown, so it's fun to be a part of it.
What's your favorite thing about Holly Springs?
I love that Holly Springs just has a lot of character of the town. Tree-lined streets, it's nice, very family-friendly, a lot of community activities, and I have 3 kids, and it's nice to be able to be a part of such a welcoming community.
And what do you like to do in your free time?
In my free time, I tend to volunteer giving eye exams and then run. So I'm an eye doctor by trade anyway. I have my own practice locally, and I'm a small business owner. But I also like to run, and I really it clears my head, it gives me a lot of good ideas, and I just really enjoy it. I'm running for Holly Springs Town Council because I really believe that we can make a difference in Holly Springs. I believe it has such a great sense of character and community, but I think we can expand on that. Right now we've got a lot of, feels like kind of unregulated growth, and I think that if we can harness that and require developers to involve more green spaces and community centers, I think we can really keep that small town feel.
So what would you say would be some of the top changes or improvements that you'd like to see if you're elected?
I would really like to be able to create more walkability, more bikeability. I think it'll tie in with, as I'm a healthcare provider, I would really also like to keep people healthy and thriving as long as possible. And I feel like if we can include more walkability, more greenway space, it will also reduce traffic as well. So it's a great way to be able to make people healthier and also just make the community a little more connected. I do think that if we have controlled growth where we require developers to build those community parks and green spaces, and also incorporate mixed density housing so that our parents who want to move back here and downsize, our kids who want to be able to grow up and move back home after college, that they are able to afford houses here. And I also think that we want our teachers and first responders to be able to live here as well. So I think when we require that with smart, balanced growth, it will incorporate all of those things and help us grow in the way that we want to. I do. Although we can't directly control rent, we can make it more streamlined for there to be more lower density housing, more townhomes, and just overall more mixed use development. When we do that, it makes it more affordable for people to be able to come in. We can also cut some of the red tape and have not only luxury apartments, so I think that it's important for us to be able to include everybody and be able to hear everybody's voices too. I do. I really believe that if we work on expanding greenways in the community centers and making the town more walkable, also improving microtransit. Now the council right now has been doing a great job of working on microtransit. They've got a line opening in January, but if we can expand on that and make it easier to be able to bike downtown or walk downtown easily, or have more local business restaurants in these community centers, then there won't be so much traffic on the roads. People are able to get to work in downtown more easily. We won't have to worry quite so much about parking. And not only that, it ties back in with me being a healthcare provider and wanting to create a healthier culture that we live in. So a lot of towns are doing it already, and I think here in North Carolina we could start that and kind of be a bright spot for the rest of the state, I'm hoping.
Do you see possible mass transit for Holly Springs?
I mean, I think it would be great, but you have to start somewhere, so starting somewhere with the microtransit I think would be a good start, and we can see where that takes us. Absolutely. I think going out to neighborhoods and holding kind of community gatherings where we can talk to people makes a difference. Obviously, being available through calls and social media, I think will help too. But also making it easier so that when we have meetings, it's not only in town hall, it's easier for residents to get to, or even just having the microtransit where people are able to come in and take a bus or a shuttle to be able to get to some of these meetings, because obviously we want everybody's voices to be heard. Well, I think it's all sort of a cycle. When benefits get cut, then hunger is, it turns into like a vicious cycle with benefit cuts. And I feel like when we strengthen like our food with subsidies, we strengthen our farmers and our local gardens, and we support local school gardens and community centers, then we can make a difference in the people who are facing food insecurities and kind of come together as a community to help support that. Well, I do feel like I've got a valuable skill that not everybody can do, and I have a heart of service, and I really love being able to give back. Homeless people can't get jobs if they can't write their own resumes, if they don't have reading glasses that they can't see. So, I like to do eye exams both locally with the local homeless shelters and provide glasses and eye care and health eye services to them as well. But I also go abroad as well. So we've been to Guatemala several times. I've been to Haiti. We take classes there. We provide eye care to very rural areas, people who wouldn't otherwise have access to care. And I think just seeing people, when you help people, we know that they can become the best versions of themselves. So I just believe in helping the community. Yeah, we already have health going not in the right direction in this country, and at a local level, when we see Medicaid cuts and people don't have access to care, then it just snowballs into a downward spiral of people not having health care access and benefits. So that's part of why I really want to work on this direct care program, because not only will it improve and prevent chronic disease, studies actually show that 80% of chronic disease is preventable. And if we can have that education through a direct primary care program, we can prevent a lot of the diseases that Medicaid and other state and federal programs are subsidizing, saving a lot of money down the road, and not only saving money, but improving the lives of people and their health span. We talk a lot about lifespan being shortened, but it's really the health span is the most important thing. What kind of healthy years are we living? Absolutely. I am myself a direct care provider in eye care, but in a direct primary care program, in any direct care, the whole idea of it is taking out the insurance middleman, where there's a better relationship between doctors and patients, and it improves so many health outcomes. So many studies show that when you have somebody who's looking out for your overall well-being, there are better health scores, reduced risk of chronic diseases, less expensive emergency room visits, less overall healthcare costs. So when we combine that with doing more walkability, making being healthy easier, so having easier access to farmers markets, local produce, being able to walk to where we want to go. In my mind, it all kind of comes together as a big picture of being able to create like a healthier population where we can move forward with healthy years instead of the direction that our current health system is going. And even though technically healthcare is not a town council sort of initiative, there are other counties and towns who are doing this that we could really, I think we can make a big difference here.